All right, let's talk about something we've all seen before. You get a lab result back, and it's just this wall of numbers and abbreviations. But what if those numbers are actually telling a story? Today, we're going to put on our detective hats and learn how to decode the clues hidden inside your own health data.
Think about this scenario, because it's super common. You feel totally fine, healthy even, but then a routine checkup flags one little number that's kind of out of range. It's so easy to just shrug it off, right? But that single number, it can be the very first clue in a much, much bigger investigation.
Okay, let's make this real. Let's look at an actual case. Meet Mr. Less Bad. He's 77, he feels great, no complaints at all. But a routine check finds this, a blood pressure of 188 over 102. Whoa. I mean, that is a huge red flag. It's our first major clue. But before we jump to any conclusions, what's the first rule of being a good detective? You question everything. So is this number even reliable to begin with?
And that brings us to the first part of any investigation. You gotta secure the scene. Before we can even think about analyzing this clue, we need to be absolutely sure it was collected properly. So let's look at the story behind this one single number.
I mean, just look at all the things that have to be just right to get one blood pressure reading. You're supposed to rest for 5 whole minutes, sit with your back and arms supported, feet flat on the ground, use the right size cuff. Heck, even just talking can throw the result off. So you've got to wonder, right? With Mr. Bod, was he rushed? Was the cuff too small? The strength of our entire case depends on whether this procedure was followed perfectly. And this is exactly why that precision is so critical. A quick, casual reading in a busy doctor's office can actually inflate that top number by 5 to 10 points. Now, that's not a tiny error. That could be the difference between being told you're fine, see you next year, and being started on a new medication. So our first big takeaway is simple. The quality of the evidence is the foundation of any good diagnosis.
All right, so for the sake of our investigation, let's say Mr. Bod's reading of 188 over 102 is accurate. Our first clue is solid. Now the real detective work begins. It's time to pop the hood and figure out what systems in the body could be pushing that number so high. Our prime suspect is the autonomic nervous system, or the ANS. The easiest way to think about it is as the body's autopilot. It just runs in the background, controlling all the stuff you don't consciously think about. Your heart rate, digestion, and yep, you guessed it, your blood pressure. Now the ANS has these two divisions that are constantly in this sort of tug of war. You've got the sympathetic system, which is your gas pedal. It's that fight or flight response that just revs everything up. Then you've got the parasympathetic system, which is the brake. That's for rest and digest, for calming things down. If you have an imbalance, maybe the gas pedal's kind of stuck to the floor, well, that can lead to chronic high blood pressure. But hey, what if the problem isn't the body's control system? What if it's the plumbing itself? That brings us to our next suspect, Peripheral Arterial Disease, or PAD. This is what happens when arteries start to get clogged up, which forces the heart to pump way harder just to get blood through. For someone like Mr. Bod, a super high blood pressure reading could be a warning sign that the whole system is under major strain from these kinds of blockages. And to really get a sense of how widespread these kinds of circulatory issues can be, think about this. One common result of poor circulation is leg ulcers. And when we look at the causes, yeah, vein issues are the big one, but look at that slice for arterial problems, like the PAD we were just talking about. That's a huge chunk. It's a really powerful reminder that high blood pressure isn't just a number. It could be a symptom of problems happening all through the body's vascular network. Okay, so one clue is never enough to solve a case, right? A good detective always gathers more evidence. So what other tests can we run to build our case and see what's really going on? So a standard investigation for hypertension is kind of like a full-on dragnet of tests. You're going to look at kidney function, the structure of the heart, cholesterol levels, the whole shebang. But for our investigation today, we're going to follow one particular clue that gives us a peek at another major risk factor, the HbA1c. The HbA1c. This little test is an absolutely crucial piece of the puzzle because it gives us a long-term view of another key player in our story, blood sugar. So what exactly is this test? Well, think of a standard blood sugar test like a single photograph. It's just a snapshot of one single moment in time. The HbA1c, though, that's the whole movie. It shows you your average blood sugar levels over the last few months. It's an incredibly powerful tool for spotting long-term trends and screening for diabetes, which is a major partner in crime in a lot of heart disease and hypertension cases.
Okay, now this is where things get really, really interesting. This shows how the performance of the HbA1c test changes depending on where you set the cutoff for a diagnosis. Just watch what happens. As that cutoff number on the left goes up, see how the sensitivity number goes down, but the specificity number goes way up? This trade-off is one of the most important ideas in all of medical diagnosis, and it's what we need to wrap our heads around next.
See, it's not enough to just gather clues. We have to know how reliable each of those clues actually is. This is where we learn to think like a true diagnostic expert. First, let's talk about sensitivity. Simply put, a test sensitivity is its power to find the people who actually have the disease. Think of it like casting a really wide net. A highly sensitive test makes sure that it doesn't miss many people who are sick. And on the flip side, we have specificity. This is the test's ability to correctly identify the people who are healthy. So a highly specific test is great at giving healthy people the all clear without raising a bunch of false alarms. So the bottom line is this, and it's super important. High sensitivity is fantastic for ruling out a disease. If you get a negative result on a highly sensitive test, you can feel pretty confident. High specificity, on the other hand, is fantastic for ruling in a disease. A positive result on a highly specific test is very convincing. They really do serve different purposes. Okay, so let's bring this all back to our HbA1c test. If a doctor uses a low cutoff, like 5.6%, they get high sensitivity. They'll cast that wide net and catch almost everyone who might have a problem. But if they want to be more certain that a positive result really means someone has the disease, they might use a higher cutoff, like 6.1%, to get that super high specificity. It's a strategic choice every single time. There's no single perfect test. It's always a balance. So, we've questioned our first clue, we've looked under the hood at the body's systems, we've evaluated the quality of our evidence. Where does that leave us? What's the final verdict? You know, this quote just absolutely nails it. A diagnosis like hypertension isn't the disease itself. It's a sign. It's a powerful clue that points to an increased risk of some really serious problems down the road. And that is the single biggest takeaway here. A diagnosis isn't a final, static label you get stamped with. It's an ongoing risk assessment. It is the detective work of piecing together all the clues, from a simple blood pressure reading to a complex lab test, while also understanding the strengths and weaknesses of every piece of evidence. That's how you build a complete picture of future risk. In the end, every single number from your checkup is a character in the story of your health. The question is, are you paying attention to the plot twists and the foreshadowing right now, or are you going to wait until it becomes a front-page headline?